Good morning. My name is Principal. My student number is 7725723. Today, I'm going to discuss about critical evaluation of a quality improvement tool of cause and effect diagram. Before going to proceed further, I would like to focus four different kinds of question. Question number one, describe the cause and effect diagram. Question number two, how is the cause and effect diagram applied in healthcare and at their particular context in which it is used? Here, I will explain one scenario based on clinical settings. Number three, on critical analysis, the cause and effect diagram advantages and or disadvantages in ensuring patient safety. The last question is, how do you consider the cause and effect diagram's overall effectiveness in ensuring patient safety? Now, what is cause and effect diagram? Cause and effect diagram was introduced by Karo Ishikawa, who is the father of Japanese quality. The Clinical Excellence Commission 2024 provides a clear outline of a cause and effect diagram, which is a graphic tool used to explore and display possible causes of a particular outcome. It has different name, Ishikawa or fishbone diagram. So the picture itself we can easily understand. This is a fishbone diagram. Always right side, the head part, it is focused on problem, and the major bones it is considered with the four main categories. So it is considered and it is related with the main problem. So it has another sub bonds. It is related with the sub causes and directly related with the main cause. Now, how is the cause and effect diagram applied in healthcare and are there particular context in which it is used? In healthcare field, a cause and effect diagram is a tool that assists in analyzing the root cause of a particular problem. For example, the problems such as poor performance or safety incidents. These tools help to identify exact root cause for the particular problem. This cause and effect diagram helps us organizing quality improvement ideas, identify and visually display several possible causes. I will explain later. Find out the root cause, and also we can see how find out the root cause with the 5 whys and brainstorming. Understanding the contributing factors. Moreover, it helps to encourage all individuals to participate in brainstorm activities. So everyone can participate for this cause and effect diagram. Fishbone diagrams are an efficient way of organizing case reports in a clinical settings. For example, we can find out poor performance and safety incidents. So definitely it will help. And finally, in problem-based learning or self-regulated learning situations, we can use this cause and effect diagram. So here, fishbone for identifying probable root cause for central line associated bloodstream infection. This is my scenario. So always I mentioned that fishbone diagram always used with the brainstorming and 5 why techniques. Sometimes brainstorming in silence. So in that case, definitely 5 whys will help us. So here, what happened? That's my problem. Central and associated bloodstream infections in ICU. So here, I used totally 5 why. So first to why. Why it is happened, number one, poor hand hygiene. Of course, we know central line bloodstream infection always uses sterile technique, follow the sterile technique. Second one, lack of skilled doctors for insertion. Usually we can see mostly senior doctors are busy in ICU, so they will advise, okay, the new doctors can continue to insert the central line. We can see because I had already experience in ICU. Then number three, non-compliance of central line bundles. As we know, we have lots of care bundles in our ICU settings. So the staffs are not following the care bundles. Then the number four is breaking the sterile technique. As long as we need to keep completely aseptic technique. Then the last one is improper catheter care and trussing is very important and always follow with the sterile technique. This is my fishbone diagram. In right side, we can see central and associated bloodstream infection in my head part. So the main bone, it has major major causes. I used four models: people, materials, procedure, equipments. These four models are very important. Usually we are using in basically we are using in healthcare settings, and we have another sub causes under the main causes. These all related to directly to the problem. So people, first of all, I'm going to discuss about the people here. People, nurse, doctor, lab technicians. As we know, nurses are important role. They are the one administering medications and all. Doctor is the one inserting. Lab technician always extracting the blood. They are not following sometimes sterile technique. So these all involve because of lack of education, lack of supervision. Now let us move to the materials. So here, poor quality of central line materials we can get to from market. Second one, inadequate use of antisepsis such as chlorhexidine. Non-compliance of central line bundles in some ICUs, they don't follow care bundles. And inadequate policy and procedure. Then the procedure settings, poor hand hygiene, lack of communication between nurse and doctors, breaking sterile technique, lack of training and education, one of the reason, improper catheter care. Then the finally equipments, lack of PPE when they are started to inserting the procedure, they are not properly wearing gloves, or maybe the used gloves, the dirty gloves they are still using until finishing the procedure. Lack of funds to buy some supplies. These all are the important factors. Then what are the advantages with this cause and effect diagram? Easy to understand with visual representation. So this is a fishbone diagram. Definitely easy to understand, easy to use. If I have one paper and pen, definitely just draw and find out the root cause. Effective use of time and resources. We are not getting too much time to prepare this diagram, and we are not requiring to get lots of resources. And also, this cause and effect diagram facilitates brainstorming, so we can get lots of ideas from others, and does not require a special tool or software. I do not want to buy something to prepare this tool. Moreover, it helps identify cause and effect relationship. So the picture looks like a bond, it is related each other, and find out the root cause quickly with the 5 whys. I've shown already. Always we have to make 5 whys. It is very easy to prepare this diagram. And the last one is fostering team communication and collaboration. So here we can see lots of participation from other members also. And what are the disadvantages with this cause and effect diagram? Number one, difficult for complex problem. For example, if I have complex problem, definitely my diagram always messy. Does not provide any solutions. The name itself we can understand. It is a cause and effect diagram. Only we can get the causes. And no prioritization of causes we can't find with this diagram, because of we don't have any idea, no guidance what causes we need to give a priority. And this is always based on the opinion rather than evidence, and sometimes unimportant potential causes leads to confusion. And how do you consider the cause and effect diagrams overall effectiveness in ensuring patient safety? In healthcare settings, regularly we need QI programs and promote system-based learning. It empowers employee to do the quality improvement principles to promote patient safety. Moreover, key steps for effective organization and performance to include a leadership is very important. Staff monitoring is important, and teamwork is important. Staff training and education is important for QI methodology. So if we do everything perfectly, definitely we can get a good outcomes and the patient safety. For example, if we do quality improvement projects very well, we can say identify the poor performance, achieve positive health outcomes, improve patient care, reduce medical errors, fostering organizational learning, and we can promote a safety culture, and also analyzing the root cause very easily, and it elaborates teamwork. So this is my presentation, and this is my reference. Thank you so much.